Hello again. I'm Dr. Mark Trolice, the Director of Fertility CARE in Orlando, Florida, and this is Christina Rostad. She's my medical assistant, and this is our next installment on her journey of being a surrogate. Now, we haven't been doing this for a couple of weeks because we had a little bit of a setback, so I'm going to let Christina tell you all what happened.
Well, I did my prenatal labs, and they tested for the varicella and rubella, the measles, mumps, and chickenpox, and I came back non-immune. So I had to get the vaccine, and that's put a little bit of a delay on things.
Which one were you not immune?
Both of them.
Really?
Yeah.
Okay, so just to put that in perspective, the rubella is actually called German measles, and varicella is chickenpox. The reason why we screen those prior to an IVF cycle and prior to fertility is acquiring those two viruses during pregnancy can cause significant risks to baby. So we want to ensure proper vaccination prior to undergoing a cycle. So once you get the vaccine, you wait about a month and then you can try to conceive. So where did you get the vaccine? Because some of our patients have some trouble finding a place to get the vaccine.
I went to the CVS Minute Clinic. They were able to do both vaccines the same day, and they said I actually needed two doses. So I would do 30 days and then another 30 days.
For the chickenpox.
Right.
Yeah, the rubella is in the MMR vaccine, and these are now typical childhood vaccines, but they can go away. The immunity can go away. So we test all of our patients to doing that. And that brings us to a good point about the screening process prior to undergoing a surrogacy cycle. So what are the things that they did with you?
As far as blood work?
They did blood work, pre-pregnancy laboratories, and any procedures?
Yes, the only procedures we did was the evaluation on the uterus to make sure everything was normal, and then the trial transfer where they had measured the depth.
One of the things they could do to evaluate the uterus is actually three things. They could either do a hysterosalpingogram where they inject dye up to the cervix. They can do a water ultrasound where they put some warm water into the uterus under ultrasound guidance, or they can do a hysteroscopy, which is a telescope through the cervix. So which one did you have?
The water ultrasound.
Okay. And then they did the practice transfer measuring the embryo. Okay, fantastic. Well, I want to ask you one more thing. Now, you have children. Have you talked to them about what you're doing and what you're going to be able to say when you start showing a pregnancy in front of your little ones?
We've discussed it a little bit. They do know that I'm going to be carrying a baby for another couple. They understand that it's not our baby, that it's someone else's. They're excited about it. I think they're more excited just to see me with a belly, but we're all excited.
That's great.
But we haven't expressed what we're going to say to other people yet. We haven't gotten that far yet.
Okay.
Baby steps.
Well, I know that I'm speaking for everybody that we think you're a hero for doing this. It is so admirable, and I'm excited to learn about this process with you every step of the way, as our viewers are. So we're going to see you again soon and keep you updated on Christina's miraculous journey. Bye-bye.